Hello guys, today we're going to be talking about the use of PACS and its relevance in the radiology department. So, what is PACS? PACS stands for Picture Archiving Communication Systems, and what that basically is a digital system where we can upload medical images or radiographs. And the good thing about this is that it can be accessed by any licensed professionals who are able to review these pictures, or really any healthcare professional who has access to the systems that have been set up for this. So, a basic PACS suite will have two monitors, one which is an image viewer and one which is a normal standard monitor. The image viewer on the right is specifically designed so that it can give us better quality and clarity over images. This is where radiographs or medical images will be uploaded onto. It's important that the radiographs can be seen with great quality and high clarity, as radiographers and radiologists will be using these images for medical diagnosis and annotations. The monitor on the left will be used for post-processing, looking at patient details as well as their X-ray history or any other histories with medical imaging. Now that we know what is in a basic PACS suite, we can have a look at how PACS is used. So in a general setting, we'd load up the patient, and on here you can see that these patients have X-rays, in this case it's a foot. Once a radiograph has been uploaded, we can then manipulate the image using several buttons and functions. In this case we've used the contrast button, and this darkens and lightens some structures. There are other functions as well. We can see here that there is an icon menu. This displays a bunch of functions that can be used to annotate or measure certain structures. There's multiple functions in the icon menu. Now that we know that PACS can be used to manipulate images so that they can look better for us, let's talk about why we use PACS. So, PACS is great because it is a digital system, and what that means is we can upload images from anywhere and upload them online or onto a secure system. This is advantageous because we can produce many radiographs and upload them onto one system, rather than back in the olden times we used to use plain films or physical films that would have to be transported all over the hospital, where now we can access the radiographs from anywhere in the hospital. This also means that we can send radiographs to any other trust or hospitals that require them for special analysis. The one downside to PACS is that because it's a digital system, there are often times where we may suffer from technical problems, where the system could shut down. This can then be a problem as we are not able to access the images online. Despite this, PACS is a very useful system and is very quick and easy to use. Doctors are able to diagnose illnesses and problems much quicker than before. Another useful feature for PACS is that it can be used by all modalities, and this also means that they can have a look at each other's radiographs or images. So someone in plain film can have a look at ultrasounds or MRIs to see if there's any interlinking problems. PACS is also a great learning tool for higher education institutes, as we are able to anonymize these pictures and send them off for research. Hopefully, by the end of this very short presentation, you now have an understanding of what PACS is, how it's used, and why it's used.